Hello, my name's Tim. For those of you that don't know me too much more, I'm 53, I'm a criminal barrister. The reason I'm making this particular video blog is to put people on notice that things can happen that you never really were expecting. And in my case, two significant things have happened in my life recently. The first was in June last year when I had a heart attack. It was I guess you could call it a mild heart attack. I had a stent fitted, it required surgery and some time off work. And then in November of last year, that's in June last year, in November of last year, I had what I thought was a mini stroke. At least that was what it was initially diagnosed as, but it was a misdiagnosis. In fact, what had happened, it would later transpire, when I went to see my heart specialist, he referred me to the neurologist who gave me an MRI, and it's been discovered, it was diagnosed about 2 months ago, that I have a brain tumour, what's known as a meningioma. And I need an operation, and the operation takes place in just over a week's time. Not many people know this. Some of my close friends and of course my partner Andrea and my family know about it, but some people don't. I am making this video blog for the simple reason that I want people to be aware that it's an illness that could be affecting you now without you realising it. So I'm hoping to put some perspective into the whole issue and try and make you sit up and realise that if you are having, for example, constant headaches, loss of concentration, inability to communicate, and for a criminal barrister, obviously that's a pretty crucial part of my life. If you are experiencing these things, you really should make your way to the hospital and insist on getting an MRI scan, because it can reveal much more than you expected. My life was going fantastically until the diagnosis. It's still going fantastically now, I've got to say, but it does involve removal of the tumour, which involves an incision on the left side of my temple, around about there, into the hairline, sadly. That's the way it is. And then part of the skull will be removed, and the meningioma, the tumour, will be taken away. At the moment it's 33 millimetres wide, so it's about 1.5 inches or thereabouts. But it needs to be removed. It's been diagnosed as benign, so it's not malignant. As far as they can tell, they won't know 100% until it's taken out. But if, and I really can't stress this enough, if you have experienced the things that I've mentioned, the loss of concentration, the inability to communicate, the feelings of the headaches, the feelings of almost like being drunk but you're not drunk, then get yourself an MRI scan. Anyway, I'll be posting more blogs as we go along, just to tell you how things are going on. I'm pretty heavily medicated at the moment, but it's working well. My life's ticking along as normal. I'm off work because I don't think it's fair for the people I prosecute and the people I defend that they should be represented by someone who's not 100% fit. But I stress again that this video blog has nothing to do with me. It's all to do with the fact that I want you to sit back and consider, and contact me if you want. I really don't mind at all. And think to yourself, if you are experiencing any unusual symptoms, what you should do about it, because it's very important that you act quickly and act within good time. Okay, so bye for now. Thanks to everybody so far, particularly my partner Andrea, and I'll keep you posted on a daily or bi-daily basis as to how things are going. Okay, thanks for now.